Welcome. Thank you for joining us for today's learning series. I'm Sarah Frazzini, Benco's Executive Director.
Hi, and I'm Misty Sorte, Benco's Director of People. Thank you so much for joining us for our third session in the Benco Drug and Alcohol Policy Learning Sessions. We are going to focus today on prescription drugs and answer questions that we've received from our staff.
I'm going to begin by going through what it says in our policy regarding prescription medications. If an employee is using a prescription medication that may impair mental or motor functioning, the employee must inform their supervisor of such drug use. It is the employee's responsibility to discuss with your prescribing physician and understand the potential side effects of the prescribed medication or medications. Any potential impairment of the safe and efficient performance of job duties caused by the medication must be discussed with your supervisor or personnel director prior to beginning work. Benco reserves the right to have a physician determine if a prescription drug produces hazardous effects or to restrict the quantity that an employee is allowed to bring to work. In addition, Benco does have the right to restrict the employee from using the prescription medication while at work. Prescription drugs may be taken only as prescribed by a physician.
So we had a lot of questions about when to notify a supervisor and wanted to provide some guidance. We understand that many individuals take prescription medications to treat episodic or ongoing medical or psychological conditions. Benco's not asking employees to disclose all of their prescription medications, and Benco supports employees working with their prescribing medical professional to determine what prescription medications to use for treatment and in identifying the side effects. Benco does require that all employees are able to perform safely the functions of their job. When the use of prescription medication may cause impairment to the safe and efficient performance of job duties, that's when Benco expects the employee to notify their supervisor of such use. So questions used to determine whether or not you need to disclose your medication are simply, does this medication impact your ability to perform your job duties as assigned? Or do you need an accommodation to use the medication and work? If the answer to both of those questions is no, then you do not need to notify your supervisor.
If the answer to those questions are yes, and you are going to have a conversation with your supervisor or the personnel director disclosing the medication and how those side effects impact you, wanted to kind of go through what to expect. So when disclosing the use of prescription medication to Benco, you can expect confidentiality and respect. If an employee voluntarily chooses to notify their supervisor of the use of prescription medication, it is the supervisor's responsibility to keep that information confidential. It is the supervisor's responsibility to communicate what has been disclosed to them to the personnel director. So that would be the only additional person that your supervisor is disclosing that information to. Benco will not ask about your diagnosis. It is not within Benco's scope to determine an employee's medical condition or fitness for duty. Obtaining medical certification from the doctor will help Benco to determine how to best support the employee in maintaining a safe work environment. So with that, Benco may require the employee to provide medical certification from their doctor regarding the effect of the medication on the employee's ability to perform essential job functions safely. If it is determined by a certified medical provider that the employee's use of certain prescription medications may pose a safety risk, Benco does have the obligation to evaluate if parameters for use or accommodations can be made. And that will happen through a confidential conversation with the employee. Each situation will be reviewed individually with respect to employee rights, safety, applicable federal and state laws, and general employer standards.
So we also wanted to talk about supplements and other over-the-counter drugs. When we talked to Samaritan Lab, the ones that do our drug testing, we got some guidance to answer this question. Because supplements and other over-the-counter drugs do not have a doctor's prescription, there's no way to verify that you are taking them and that a non-negative or positive result would come from that instead of drug use. So we are asking each staff member to determine their own needs and assess the risks of taking supplements and other over-the-counter drugs. Talk to your medical provider or healthcare specialist to determine the best way to address your healthcare needs. You may also be able to have your provider write in their physician's notes that they are recommending supplements, which would provide at least a little bit more paper trail for those supplements. If you're concerned that a supplement or over-the-counter drug may impact the results of a drug test, disclosing this information to the testing provider is absolutely encouraged. Always strive for honesty and transparency. If you believe the test result is a false positive, you can ask Benco what options are available to retest or have the results reviewed by a medical officer.
A little bit more in regards to the testing process through Samaritan Lab. Again, like Misty mentioned, having that proactive communication is really key. What you communicate, how you communicate is important. So provide information to the lab proactively, and this can really help to ensure that your results are accurate and they come back more quickly. If a non-negative result comes back, the Samaritan Lab will move that forward to a secondary investigator who then reaches out to the employee to have a conversation asking about prescriptions that the employee is taking. And so it is important that if you are providing a sample for drug testing, that you answer phone calls or at least return the message to those phone calls. Samaritan will make 3 attempts to get a hold of the person. And if the person does not answer the phone or return that phone call after those 3 attempts, the Samaritan Lab does consider that a positive result. And that's what would be communicated to Benco. So once, kind of that third party is doing the investigative process, Benco isn't privy to any of that information. The only thing that's communicated to Benco is whether or not an employee has passed the drug test or it has come back as a non-negative. So we want to make sure that you have really good communication with the Samaritan Lab throughout that process.
And the takeaways for this session, we really want you to understand that Benco supports employees working with their prescribing medical professional to determine what medications to use for treatment. We encourage employees to talk with their prescribing medical professional to identify side effects that may cause impairment to the safe and efficient performance of their job duties. We ask that you only use prescription medications issued in your own name and stored in the original container while on Benco premises. And again, when used by a prescribing doctor, we understand that medications are helpful in treating many illnesses. If an employee is on medication, they must use it in accordance with the prescribed orders. We understand there are a lot of questions, and as we go through these sessions, we ask that you continue to refer to our recordings of the sessions and send your questions directly to the HR team, Suzanne and I, or Laura and and Sarah for any questions and guidance on the drug and alcohol policy.
And once we have completed our 5-part learning series, FAQ will go out to all of our employees and will also be posted on our website to refer to. Thank you so much for spending the time watching this and listening to this. We really appreciate your desire to learn more, and just want to make sure that all of our employees are getting the information that they're looking for and getting the answers that they need. Have a great rest of your day.
Thank you.